Welcome, dear listeners, to another episode of Pulse of Health, where we explore the latest developments and pressing challenges in the world of healthcare. In this extended episode, we delve into a critically important topic: the future of U.S. healthcare, challenges, and opportunities. The American healthcare system is a complex and often debated subject, characterized by its advanced medical technology, world class research, yet also by its high costs, accessibility issues, and significant disparities. Today, we aim to unpack these layers, examining the intricate dynamics that shape healthcare delivery and outcomes across the nation. We'll look at how innovation is driving change, the demographic shifts that are reshaping demand, and the policy debates that continue to define its trajectory. Join us as we navigate the multifaceted landscape of American healthcare, seeking to understand where it stands today and where it is headed in the years to come. Segment 1: The U.S. Healthcare Landscape, a Complex Ecosystem. The United States healthcare system is unique among developed nations, primarily due to its market-driven approach and the significant role of private insurance. Unlike many countries with universal healthcare, the U.S. system is a mosaic of public and private payers, providers, and regulatory bodies. This complexity often leads to a fragmented system where access, cost, and quality can vary dramatically, depending on an individual's insurance status, geographic location, and socioeconomic background. Understanding this foundational structure is crucial to appreciating the challenges and opportunities that lie ahead. The system is characterized by a blend of employer-sponsored insurance, government programs like Medicare for the elderly and Medicaid for low-income individuals, and a growing individual insurance market. This multi-payer system, while fostering innovation in some areas, also contributes to administrative burdens and often leaves millions uninsured or underinsured. The sheer scale of healthcare spending in the U.S., which far surpasses that of other high-income countries, raises fundamental questions about value for money and equitable distribution of resources. Segment 2: Key Challenges, Cost, Access, and Quality. The American healthcare system faces a triumvirate of persistent challenges: escalating costs, uneven access, and variable quality. These issues are deeply intertwined and often exacerbate one another. Cost and affordability. The U.S. has the highest healthcare spending per capita in the world, yet this expenditure does not always translate into superior health outcomes. A significant portion of this cost is borne by individuals through high premiums, deductibles, and out-of-pocket expenses. Medical debt remains a pervasive problem, with millions of Americans struggling to pay their medical bills, often leading to bankruptcy or delayed care. Factors contributing to these high costs include the price of prescription drugs, administrative overhead, the fee-for-service model, and the lack of price transparency. The debate over how to control these costs without compromising quality or access is a central theme in American politics and public discourse. Access to care. Despite efforts to expand coverage, access to healthcare remains a significant barrier for many. Millions of Americans still lack health insurance, and even those with insurance may face high deductibles or limited networks that restrict their choice of providers. Geographic disparities are also pronounced, with rural areas often experiencing shortages of healthcare professionals and facilities. This uneven access leads to delayed diagnoses, poorer management of chronic conditions, and ultimately worse health outcomes for vulnerable populations. The COVID-19 pandemic further highlighted these disparities, revealing how existing inequalities in access can be magnified during a public health crisis. Quality and outcomes. While the U.S. boasts some of the world's leading medical institutions and specialists, the overall quality of care and health outcomes are not consistently superior to those in other developed nations. For instance, the U.S. lags behind many peer countries in life expectancy and infant mortality rates. This paradox can be attributed to several factors, including the fragmented nature of the system, a focus on acute care rather than preventive health, and the social determinants of health that often go unaddressed. Improving quality requires a systemic approach that emphasizes evidence-based practices, patient safety, and coordinated care across different settings. Segment 3: Technology and Innovation, a Double-Edged Sword. Technology has always been a driving force in healthcare, and in the U.S., its adoption is particularly rapid and transformative. From advanced diagnostic tools to groundbreaking treatments, innovation promises to revolutionize how care is delivered. However, this technological advancement also presents a double-edged sword, bringing both immense opportunities and significant challenges. Artificial intelligence and machine learning. AI and machine learning are increasingly being integrated into various aspects of healthcare, from enhancing diagnostic accuracy in radiology and pathology to personalizing treatment plans and predicting disease outbreaks. These technologies have the potential to improve efficiency, reduce human error, and unlock new insights from vast amounts of patient data. For example, AI algorithms can analyze medical images with remarkable precision, assisting clinicians in detecting subtle anomalies that might otherwise be missed. Similarly, machine learning models can identify patients at high risk for certain conditions, allowing for proactive interventions. However, the ethical implications of AI in healthcare, including data privacy, algorithmic bias, and the potential for job displacement, are critical considerations that require careful navigation. Telemedicine and remote monitoring. The COVID-19 pandemic accelerated the adoption of telemedicine, transforming it from a niche service into a mainstream component of healthcare delivery. Virtual consultations, remote monitoring devices, and digital health platforms have made healthcare more accessible, especially for individuals in rural areas or those with mobility limitations. This shift has not only improved convenience, but also demonstrated the potential for cost savings and better management of chronic conditions. Wearable devices that track vital signs and activity levels are becoming more sophisticated, providing real-time data that can empower patients and inform clinical decisions. Yet challenges remain, including ensuring equitable access to technology and broadband internet, addressing regulatory complexities across state lines, and integrating these digital tools seamlessly into existing healthcare workflows. Precision medicine and genomics. The advent of precision medicine, driven by advances in genomics and bioinformatics, is ushering in an era of highly personalized healthcare. By analyzing an individual's genetic makeup, lifestyle, and environmental factors, clinicians can tailor treatments and preventive strategies to be more effective and minimize adverse reactions. The goal is to move away from a one-size-fits-all approach to medicine towards therapies that are precisely targeted to the individual. However, the ethical considerations surrounding genetic privacy, the cost of genomic sequencing, and the equitable distribution of these advanced therapies are ongoing debates that need to be addressed as precision medicine becomes more widespread. Segment 4, Policy Debates and the Future of Healthcare Reform. The American healthcare system is perpetually at the center of political debate, with ongoing discussions about reform, funding, and the role of government. These policy debates are crucial in shaping the future direction of healthcare in the U.S. The Affordable Care Act, AC. Since its enactment in 2010, the ACA has significantly expanded health insurance coverage, particularly through its marketplaces and Medicaid expansion. However, it remains a contentious piece of legislation, with ongoing efforts to repeal or modify it. The ACA's impact on insurance markets, premium costs, and access to care continues to be a subject of intense scrutiny and political maneuvering. Future reforms will likely build upon or diverge from the ACA's framework, addressing its perceived shortcomings while attempting to preserve its gains in coverage. Medicare and Medicaid. These foundational government programs provide health care to millions of Americans. Medicare for those aged 65 and older and certain younger people with disabilities, and Medicaid for low-income individuals and families are vital safety nets. However, both programs face long-term financial sustainability challenges due to rising healthcare costs and an aging population. Debates around eligibility, benefits, and funding mechanisms for Medicare and Medicaid are central to any discussion about the future of U.S. healthcare. Proposals range from increasing taxes to fund these programs to implementing more market-based reforms. Public health and prevention. Beyond individual care, the importance of public health initiatives and preventive medicine is gaining increasing recognition. The COVID-19 pandemic underscored the critical role of public health infrastructure in responding to widespread health crises. Investing in public health, promoting healthy lifestyles, and addressing social determinants of health, such as housing, education, and food security, are seen as essential for improving overall population health and reducing the burden on the healthcare system. However, funding for public health often lags behind spending on acute medical care, highlighting a persistent challenge in resource allocation. Segment 5. Addressing health disparities and equity. Health disparities are a pervasive and deeply rooted problem in the U.S. healthcare system. These disparities refer to preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Addressing these inequities is not just a moral imperative, but also crucial for the overall health and economic well-being of the nation. Racial and ethnic disparities. Historically, racial and ethnic minority groups in the U.S. have faced significant barriers to accessing quality health care, leading to worse health outcomes across a range of conditions. Factors contributing to these disparities include systemic racism, socioeconomic inequalities, lack of culturally competent care, and implicit bias within the healthcare system. For example, Black women are significantly more likely to die from pregnancy-related complications than white women, and Hispanic populations often face language barriers and lower rates of insurance coverage. Efforts to address these disparities include promoting diversity in the healthcare workforce, implementing culturally sensitive care models, and investing in community based health initiatives. Socioeconomic disparities, income and education levels are strongly correlated with health outcomes. Individuals from lower socioeconomic backgrounds often have limited access to healthy food, safe housing, and quality education, all of which are critical determinants of health. They are also more likely to work in hazardous occupations and have less access to health insurance and preventive care. Policies aimed at reducing poverty, improving educational opportunities, and strengthening social safety nets are essential for mitigating socioeconomic health disparities. Geographic disparities. Rural communities often face unique challenges in accessing healthcare, including a shortage of healthcare providers, limited transportation options, and fewer specialized services. This can lead to delays in diagnosis and treatment and poorer health outcomes compared to urban areas. Telemedicine and mobile health clinics are emerging as potential solutions to bridge these geographic gaps, but significant investment and infrastructure development are still needed. Conclusion. The future of U.S. healthcare is a dynamic and evolving landscape, shaped by a confluence of technological advancements, demographic shifts, policy debates, and a growing recognition of the need for equity. While significant challenges persist, particularly concerning cost, access, and disparities, the opportunities for transformative change are equally profound. The integration of AI, the expansion of telemedicine, and the promise of precision medicine offer pathways to more efficient, personalized, and effective care. However, realizing this potential will require concerted efforts from policymakers, healthcare providers, technology innovators, and the public. It demands a commitment to addressing systemic inequities, prioritizing preventive health, and fostering a healthcare system that truly serves all Americans. As we look ahead, the journey to a more equitable, accessible, and high-quality healthcare system in the United States will undoubtedly be complex, but it is a journey worth undertaking. Thank you for listening, and join us next time on Pulse of Health.